Hello, and thank you for joining me for Endometriosis Warriors, Patient Accounts of Misdiagnosis, Mistrust, and Self-Advocacy. My name is Arlene Votruba, and I'm a PhD student in the Cultural Studies Department at Claremont Graduate University. To begin, I want to talk about what is endo. Endo impacts about 200 million people living with internal reproductive anatomy between the ages of 15 and 49. I refer to endometriosis warriors as a gender-neutral way to describe those folks with internal reproductive anatomy who are most likely to encounter the disease. Endometriosis patients encounter an average delay of 10 years before receiving medical diagnosis. My project is concerned with the question, why does it take 10 years for endometriosis warriors to receive a diagnosis, and how are cultural influences involved or part of that relationship of the 10-year gap? Specifically, endometriosis, and this is a very consolidated and brief description of what the disease is a disease where tissue that typically grows inside the uterus, known as endometrial tissue, is grown outside of the uterus in abnormal places and has no way to escape the body through the vagina, like in a monthly period. And you can see in these pictures that, for example, the growths can form web-like or cyst-like growths that can connect organs or impact organs' ways of functioning because the tissue is growing where it should not, and sometimes can do damage to them. So other symptoms that come with endometriosis, besides pain that results from these growths, are things like infertility. And so even though there's 4 stages of endometriosis, the stages do not correlate to the symptoms. So someone with severe pain could be in stage 1, and someone with no pain could be in stage 4 and realize that they have endometriosis because they're dealing with fertility challenges. Again, this is a very consolidated explanation of the disease, and I highly recommend checking out a more comprehensive description of the disease for those of you interested. In my project, I interview participants who volunteer to share stories and their experiences about living with endometriosis. I gathered my participants via self sign up on social media, and just by connecting and reaching out to friends and having them ask around if anyone that they knew was interested in participating. You can see in this chart a variety of the participants, their age ranging from 28 to 47, and the length of time that it took for them to receive a medical diagnosis, ranging drastically between 8 years to 24 years. This chart is mainly to demonstrate that these folks are coming from all areas in the United States, that they are of different races and ethnicities, and that the number of surgeries ranges, but everyone that I have spoken to has been medically diagnosed through surgery, which is the way that doctors currently are able to identify and confirm the diagnosis of endometriosis. I start with a quote from one of the participants to highlight the type of narrative that was shared over and again. While this quote refers to women, I do want to re-articulate that endometriosis can impact anyone with internal reproductive anatomy, regardless of gender identity, but these are the words of a participant themselves. I also refer to the participants in general and do not tie any of the quotes to the participants for this presentation because of the consistency with which these participants shared their stories and the patterns that came up. It could have been interchangeable in many instances when one described their pain or described their being dismissed by doctors, and the ways that they described things was so consistent that I thought taking out their names was useful because it shows that these are shared experiences. It's not one in the bunch. So this quote, it captures women's tireless struggle. I feel like endometriosis is a symbol of how wronged we are. 1 in 10 women have it, which is a lot of women, and we're not heard, we're not seen. We have to do our own research, we have to struggle, we have to seek out the right people. We're wronged by a lot of doctors who do not have the guts to admit that they don't know what they're doing. So I feel like it's really a symbol of how hard it is for us in the medical community. I think as a jumping off point, it's really important to recognize that endometriosis warriors are seeking help to treat sometimes severe pain, discomfort, or fertility challenges, which is a timely issue. And yet, the medical community does not respond in what I deem an adequate timeframe. So themes that emerged through my interviews. I conducted about 1 hour Zoom interviews, give or take, depending on how much the participant had to say. And throughout my conversations, the key themes that showed up again and again in our conversations were the mistrust and myth of pain as normal. So the mistrust between the patient and the doctor, misdiagnosis and the way that being misdiagnosed or told that the pain or issues and symptoms that one was reporting were something other than endo impeded the process and made it take longer for folks to get to an accurate diagnosis. And then the emerging self-education and self-advocacy that resulted from going through this experience, being dismissed, incurring challenges, and then developing strategies for one to take control for their own health in the process. So to begin, I do want to highlight how endometriosis warriors in a couple of instances have described their pain before talking about how pain has been dismissed as normal when endometriosis warriors address doctors or medical practitioners. So one of the participants described pain as crippling pain that sometimes feels like my spine is being ripped out of my back from the base. Another participant, one of many who noted the connection between the pain they experienced from endo and childbirth, said, if I had never had a child, I would have never known that that's what I was experiencing the whole time, and sometimes it's stronger than labor now. So just for context, these are the types of descriptions that I saw throughout my sample in terms of what it was like to live with endo. And although these descriptions would throw a flag to anyone to say, okay, something's wrong here because this is not a normal or comfortable or livable, bearable amount of discomfort, there was a consistent reporting of a mistrust between the patient and doctor, specifically that the patient would report these symptoms and pain, and the doctor would say, this is normal. So here's a quote that stood out as being an example of one of these instances. All of the doctors I talked to said it was normal, and I just must have a small vagina, or my boyfriend's penis must just be big, or cramps are just painful for women. I heard over and again reports that doctors said this was normal. I also heard reports that family members and friends and people in their lives said that this pain is normal. And in many of these instances, like we see here, the example that, and I just must have a small vagina, the patient reporting symptoms was often blamed for because of their body, or as if it was a deficiency with them, that was why they were experiencing this, not that there was a disease inside their body causing these issues. It is a myth that pain is normal in all circumstances, and in endometriosis, it's important that we recognize that there needs to be trust from doctors towards their patients, and that when folks report pain, it is taken seriously. Here, I'm going to discuss a little bit about misdiagnosis. On the left-hand side, you can see a list of the common illnesses that are often diagnosed in lieu of endometriosis. So folks are often told that this is IBS, a mental health problem, appendicitis, and so on and so forth. And these diagnoses interrupt the time it takes, or they slow down the time it takes to get an endometriosis diagnosis, because instead of getting on the right track and treating endo, someone is told you have appendicitis. And so then they try to treat appendicitis, but that is not what's going on. And so that is going to lead to a dead end. In one of the books that I've read about endometriosis, there was a statement that essentially saying that endometriosis is a mental health issue is like putting a cast on a foot for a broken arm. Misdiagnosis is described in these following quotes from the participants. I don't have lower quadrant left side pain because I'm anxious. That's not how that works. I don't have a medical degree, but I feel pretty confident in that fact. In this example, the participant shared with me that their doctor said, oh, you sound like you're anxious and maybe you need to see a therapist, but they could point to their pain. They could show you where on their body they were feeling consistent chronic aches, pains, and sometimes severe flare-ups, and yet they were told that they're anxious. Another participant said, they misdiagnosed me with pelvic inflammatory disease, and they had a nurse practitioner look at me, and I was like, this doesn't make sense. Like, I wasn't sexually active at the time. I was 19. I was still a virgin. So I was like, doesn't pelvic inflammatory disease sometimes come from STDs? I kind of started reading, and I was so confused. So here again, we see a misdiagnosis of PID, or pelvic inflammatory disease, that not only challenged what the patient understood of themselves or of medicine, but also led them in one direction when really they needed to be diagnosed with something else. Misdiagnosis is a really common factor that influences the delay in diagnosis of endometriosis. And while it is a medical issue, I would also say it's a cultural issue, because some of these diagnoses, such as mental health, stems from gendered stereotypes of women and hysteria, or pelvic inflammatory disease as being more common in African American patients. And my data reflects these patterns. So what happens when one is seeking answers to an illness that is frustrating, often debilitating, whether physically or emotionally, as someone is trying to start a family, and one is consistently brushed off at the doctor's office or told, we don't know. What I found in my study and throughout talking to all of these incredible folks was that self-education was a direct outcome of the delay in diagnosis. So folks took it into their own hands to seek information, to find out answers, join online groups, write into questionnaires, all these different things where they were trying to find answers for themselves and educate themselves. So here's a quote that captures that. I think self-education is the most important part of the journey, because had I not learned on my own, I would still be so lost, probably still doing surgeries that were not effective, on birth control that was not effective. You know, there's so much that I would still be doing wrong had I not educated myself. Self-education is critical in anyone's healthcare, but in particular, endometriosis, which is so widely misunderstood and has so many associated myths, regardless of how common it is, requires that folks seek out information for themselves and question the information that they're given. In addition to self-education, self-advocacy becomes another step in the process of getting to the bottom of what the patient needs. So this participant shares, and I feel like us as endo warriors have to be advocates, but also have to educate, right? I have to educate you on my disease. I have to educate you as a doctor who went to school to learn about these things, because you have not been educated. However, 1 in 10 women have this disease, and there's all this misinformation flying around. So for me, having to educate doctors is exhausting and it's upsetting, but what I realize is those of us in the endo community have literally come together to figure out our healing on our own. Self-advocacy becomes a step in the process to use the education that folks are gathering through their process of figuring out what's going on when it is endometriosis, and then sharing that information and spreading awareness through what they've learned along the way. To conclude, I just want to share that this is a work in progress. I am working on this collection of data for my larger dissertation project, and there's still so many themes and patterns coming up that I'm not entirely certain what exactly are going to be the key points. This said, awareness and advocacy are absolutely necessary pieces of the puzzle, because it's not until folks hear the word endometriosis or have access to a group of online community where people are talking about reproductive health issues, until then, they're not getting close enough to even learn what this illness is. And so awareness is key. Endometriosis should be a household name, and advocacy and spreading awareness and sharing that education is a necessary step in managing the gap between symptoms and diagnosis. Additionally, I hope that my work will contribute to calling into question how trust is built in medical contexts and how doctors determine whether or not to acknowledge and believe their patients. Finally, through gathering this qualitative data, I hope to really uncover what cultural influences are at play in the delay in diagnosis, so that we can move forward in medical practice education and in just general education of reproductive health in the public, to inform folks about endometriosis, to teach them how to identify if this might be happening to them or someone around them, and to figure out the best course of action in terms of how to start getting to that diagnosis and subsequent treatment that they deserve. Finally, I just want to say, for more information, or if you know someone who might wish to participate in my research project, you can feel free to email me directly at arlene.votruba@cgu.edu. Thank you so much for listening today, and it has been a pleasure participating in this conference.